Hi, I'm Dr. John Friedrichs, and I just want to share with you a little bit of what we do with spinal decompression therapy in our office. We've been doing decompression therapy for over 16, 17 years, and it's amazes me to this day that a lot of people still don't understand the powerful benefits of spinal decompression therapy. So when people come in with severe chronic back pain, whether it's radiating down the leg or down the arm, or just central in the spine of the neck and or lower back, we assess their spine for spinal joint alignment and spinal motion, and then to see and identify if there's any degenerative changes that might be occurring. We utilize X-ray and or an MRI that will help us better understand what's happening. Um, with spinal pain, a lot of times it's due to compression of the joint on the disc and or what we call the facet joints, which are the back part of the spine. And when those joints get compressed due to degenerative discs, then those joints are a lot closer together. And because of the compression on the joint itself, it creates inflammation, which gives you chronic central pain. Now, a lot of times, or in many cases, we might have a herniated disc or a protruded disc, those things that we can identify with an MRI. And then we're able to clearly determine which vertebrae or which segment is affected, and then we can clearly treat that area with spinal decompression therapy. And this is just a model to show us. These are two vertebrae that are together with a healthy disc in between. In between also have these spinal nerves on each side that branch off. The disc is designed to create space in between the vertebrae, right? And that space creates space for the nerve to get out. And the spacing also allows for these joints to rest on top of each other without being compressed severely. If we get a spine that enters our office like this, then that disc is really thin, creates a narrow space for the nerves. The nerves can get compressed. That can create pain down the arms or the legs, depending on where it is on the spine. But then it can also, if these joints are compressed like this, it can also put pressure on these facet joints. And when there's pressure on the facet joints due to a thin disc or a degenerative disc, then those facet joints will chronically be inflamed. And when you have inflammation, it's going to give you pain and discomfort. That's why in many cases, ice will help lower back pain if it's not muscular related, because there's so much inflammation in these joints. Decompression therapy does this. It's fantastic. What it does is slowly and gently separate it out or decompress that area. And as a result of doing that over and over and over again, over a short period of time, we're able to increase the height of that disc, create spacing between the vertebrae, and create enough space for the nerves to exit the spine comfortably without irritation, and for these facet joints not to be chronically stressed where they have chronic continual inflammation. So how do we determine if you need spinal decompression or if that's your answer for your back pain that you're struggling with now? Well, get in to see a chiropractor and see if they can help you. We utilize X-ray, but more often than not, we're going to need MRI just to see exactly if there's a disc injury involved in the case. If there is, and if it's not too severe, it's very likely we can help. We've also helped quite a bit of people that have severe pain too, that could barely walk in the office and then they're able to walk out. But we'd like to definitely address it before it gets to be that point. So a little bit on spinal decompression therapy, how it can help spinal conditions such as sciatic, chronic central low back pain, pain or tingling down the arms and or the legs, just chronic pain that's just not going away and you've tried everything you can. The two key components to a healthy spine: spinal alignment and spinal motion within that alignment. And then if there's more severe issues going on, it might need spinal decompression too. Hope that helps you understand spinal decompression. Have a great day.